Comparison of the first and second urines. Having tested for phosphates by the addition of a few drops of acetic acid and dissolved these, if present, by adding an excess of this acid, the physician holds the 2 glasses into which the patient has passed his urine against the light and compares their contents. Footnote: comparative examination of the 2 urines is of no interest if the patient is a woman, since the differences in them are chiefly accounted for by the vaginal secretion in the first glass. It is scarcely necessary to add that examination of a 3rd glass is equally inapplicable to women. The first urine passed is the urine as it lay in the bladder, plus what it has swept from the urethral walls. The second urine passed is the urine as it lay in the bladder, without admixture of anything gathered from the urethra during its exit. Footnote: this elementary physical fact that the first fluid flushes the outlet and the second comes clean from the tank would scarcely require explanation were it not for the fact that so many physicians believe that the first urine passed shows the contents of the anterior urethra, the second those of the posterior urethra. This fundamental error is fostered by the clinical fact that the contents of the posterior urethra are often mingled with those of the bladder before urination. In this event, the first urine passed contains what it sweeps from anterior and posterior urethra during the urination, plus what has entered the bladder from the posterior urethra between urinations, while the second urine contains only what has flowed back into the bladder from the posterior urethra between urinations, supposing the bladder and kidneys add no contamination. Thus, the comparison of the 2 urines may, under certain conditions, show one the content of the anterior urethra, plus that of the posterior urethra, the second only that of the posterior urethra, and under these special conditions, the first urine does roughly represent the anterior urethral washings, the second urethra the posterior. But to step from this particular to a broad generalization is inaccurate and misleading, both in theory and in practice. This rule has but 2 exceptions, as follows. 1. If the insoluble substances suspended in the bladder urine are very dense, they may settle to the bottom as the urine lies in the bladder and come away chiefly with the last drops of urine. The substances which fall within this exception are blood clots, crystals, usually phosphates, and pus, when present in great quantity, such as usually comes from pyonephrosis. 2. The second urine may also be contaminated by whatever may be squeezed from the urethral wall during the piston stroke, muscular spasm that clears the urethra of the last drops of urine. Under this exception come pus squeezed from the prostatic ducts or from a prostatic abscess when the prostate is gravely inflamed, and blood squeezed from the bladder neck or from the adjoining surface of the bladder or urethra when this is acutely inflamed, ulcerated, or the seat of neoplasm. These exceptions amount clinically to this. The 2-glass test may mislead in the presence of bleeding or of active suppuration in prostate or kidney.